Hi, come on in. Welcome to Advocare Fairmount Pediatrics. Hi, I'm Dr. Heather Ruddock, and I am a pediatrician at Advocare Fairmount Pediatrics. And I have been fortunate enough to have had a rigorous educational background, both in undergraduate and in my pediatric training. I've also worked in a variety of different areas, from emergency rooms to rural pediatric medicine, urban environments, and suburban environments. And what this really adds to my experience is that in our practice now, where we have 3 locations, it really makes my practice and my experience with children a bit more robust. So this exposure to different environments has really helped me to care for a diverse population of patients and patient families. Our providers are also from a wide variety of backgrounds, and we really work collaboratively to take care of our patients, and it makes for a very informed and very colorful practice management style. I have been fortunate enough to work in a wide variety of practice settings with patients who have a wide variety of resources and patients that don't have that many resources. I find that what I'm most proud of is being able to really give top tier advice and top tier clinical management to patients who really don't have that many resources. That's what I've been most proud of. I find that diverse patient population that I've served, and both the diverse nature of our provider staff, just makes my experience very rewarding in this practice. We serve 3 different locations in our practice, and with that, we have a wide variety of patients that have access to us. And with our different backgrounds as provider staff, it really does help in our collaborative approach to work as a team to serve those patients. I also have some running background. I've been a runner for a really long time. I find that gives me a little bit of fun perspective with families. Parenting, I find, when I've spoken to families, is really, running this long race, which I know a little bit about. Really pacing yourself and staying in the game, and as well as making sure you fuel yourself so that you can kind of give your best effort. I find that analogy helpful in my management of patients and families. What I'd like to say about my area of specialty in pediatrics is that I'm very much a generalist. I've had a wide variety of practice settings that I've worked in, as well as trainings. So when I add in things like the emergency room and the REACH, it's an acronym, training within mental health and behavioral health, it really does help inform my practice style with patients, and helps me give a bit more information, if you will, whether it's within whichever topic we're talking about. And REACH actually stands for Resource for Advancing Children's Health, and is a training program for pediatricians and primary care providers to enhance their understanding of mental health diagnoses and how to treat them in a primary care setting. What makes Advocare really special is that we provide high quality medical care and make it more personal. So we have a very personal style when it comes to our communication. We have enough time within our practice visits for our patients so that you don't feel rushed and we don't feel rushed. And it makes for a good experience in the office. We also work as a team. You're not dealing with just the provider that you're talking to. We always field other perspectives and bring those perspectives back to the patient and help you really manage and be the best parent that you can be for your kiddo. So I think what I'd like to achieve while at Advocare, and I've been here for many years now is to really develop close relationships with families where they feel that they can reach out for anything, even the simplest question. They can feel comfortable to message us on the portal, message me on the portal. I'd love to demystify the whole doctor thing. I actually live in the neighborhood, and it's been nice to see patients in the neighborhood that I live in, whether it's in the grocery store or on the trail. If I'm running, it's nice to just wave and just be part of the community. That's one thing that's really been very important to me. So, what makes Advocare different from other practices, Advocare Fairmount Pediatrics different from other practices, is that we really make our care much more personal. We consider ourselves just almost part of the family with you, partnering to help you take care of your kiddo in the best manner possible. We are always, I feel, available. We have a large enough team that is not something we consider burdensome. It is something that we value in our care for our patients. We want you to be able to reach out and get quality information and advice at any point. We love seeing you in the office, but we also like being available to you outside of office times within reason. And that's really what we'd like to have stand out about our practice when compared to the many other choices that you have in this city. At the end of the day, I'd like to be a part of your team. Really, the goal is to help you be the best parent that you can, and to help you feel comfortable enough in our practice setting to involve us in every aspect of your child's medical care. We really hope to see you soon in the office, and welcome to our office if you're considering. Please come and meet us. We do meet and greets in our office where you can actually come and meet the providers, and we'd love to see you in the office and answer any questions that you have.